So here we have a patient who has lost 110 pounds all by himself, just by diet and exercise, which is really impressive. That's hard to do. So what we're going to do now is we're going to flatten his chest. And you can see he's got so much excess skin that we're going to need to remove skin in a circumferential manner. So I'm going to show you the most important things that I look at when I mark this. So I'm going to turn you back. So the most important thing that we're going to do is we need to set the nipples. And the way that I do that is I measure the chest length, which is down to where the pec major gets its origin. So this was measured out at 21.5 centimeters. Therefore, I placed the nipples at 21.5 centimeters. That means it's going to be sitting back on top of the pec, because you can clearly see that the nipple is no longer on the chest, it's actually on the abdomen. So this is exactly where it needs to be. It's really important not to get the nipple placement too close to the midline, because that looks funny. You can actually place it a little bit more laterally and you're okay with that. But this is ideal. We've just marked these lines that I call timelines, because this goes back in time to where that nipple was. So now that you can see how many times I remarked it, because it's got to be perfect. That nipple placement has got to be perfect. So here we have it marked, it's even, and then the next important thing is to make sure that the inframammary fold, this upper incision, is placed at 2.5 centimeters below that. What that means is that's the normal outline of what a chest looks like. So you can see that what we're going to be removing, again, we're going to be doing some liposuction here to bring that up somewhat. This is more of a tummy tuck, but we're going to get that up to a large degree. And these two lines are going to end up coming together. And it may even be a little bit more than that. And what I've done is marked it out all the way around. And you can see the amount of excess skin. We're going to suction this, bring this back up, and you can see I created a little wedge that we might need to remove skin in this horizontal direction, because this is what I call, it's like having a pair of socks in your armpit. It's just this fullness that we may want to get rid of. I'll see that on the table. And then going around to the back, again, we've got these multiple rolls. We're going to be suctioning this and then bringing that up and getting them nice and tight.